We're located in Providence, Rhode Island. We have about 13,000 students, faculty, staff. Our annual budget is about $950 million. We had been using a 40-year-old financial system, and we had a budget and planning system which worked with the 40-year-old system, but when we went to Workday and used their data model, our old system broke, essentially. We didn't want to rebuild that, so we looked around for somebody that knew Workday, understood work tags, and so Tidemark was sort of the answer to that question.
The implementation process for Tidemark really worked out well. It's a methodology where you don't get too far. There's a series of checkpoints where it's like, how is the application developing? Are we happy with it? Is the functionality being delivered and available in the way that we need it? And if not, you have an opportunity to tweak and adjust it. Brown was in a very exciting position that we could work with Tidemark in developing the application and link important things like position and budget planning, and the interoperability with Workday, kind of bringing it all together.
We have about 200 users. Basically, it's people in the academic departments or an administrative department building their own budget. So one unit might be building a $45 million facilities budget, and another might be a person building a $1 million budget for the archaeology department.
The analytics and the insight that we were able to get with Tidemark was new and refreshing, and so we knew that the folks making key decisions for Brown University would be able to have this and use this as an effective tool for strategic decision making.
At Brown, with the move to Workday and Tidemark, it really enabled everyone to have way more access to data. So basically, we've given people access to all this data to make better decisions, and before it was all hidden and really hard to find. And we also have at Brown consistency now that people are doing things the same way, and we can know that the School of Medicine and the School of Public Health are using the same data, and we can combine them much more easily than we could before.